Okay, so how infusion therapy works. We're going to take a look at flow dynamics and the physiology of flow very briefly. So, physiology behind infusion therapy involves pressure, gravity, and flow. By pressure, we mean a force that overcomes resistance to the flow of the substance through the circulatory system. So, as you can imagine, the circulatory system is a very high pressure system, especially the arterial system. The venous system has less pressure, but still there is a pressure exerted from the venous system and the fluid going through it. So, pressure is the required force that it takes to overcome that pressure within the circulatory system in order to infuse the IV infusion solutions into the body itself. So you do have some natural resistance. This comes from the administration set or the IV tubing. As you may recall back from your high school days, anytime a substance rubs up against the walls of another substance, there is a degree of friction and resistance that is generated there. So as the IV solution, whether it be the blood, the IV fluids, TPN, as it goes through the administration set, tubing itself, it does create or experience some resistance there. Filters in an IV set will also create resistance. Filters typically we see with certain antibiotics and with primarily with blood transfusions. We'll see a filter being used, and of course this is more exposure to a surface area to which the fluid will become an interactive or will interact with, thus creating some resistance. Narrow gauge needles, and we talked about this a little bit when we discussed some of the concepts behind, choosing needles or considerations to make as far as setting up for IV infusion. Remember, narrow gauge needles have a lot smaller bore, so you're having to overcome the resistance of that small needle bore or the small gauge of that needle, the small hole in that needle, as you infuse fluids. So this is one of the reasons when we are infusing blood products, so we don't use a small gauge needle or a narrow gauge needle. We want to use a larger gauge needle in order to administer blood, because if you don't, the pressure that you have to exert to infuse that blood through that narrow needle causes damage to the red blood cells as it passes through. And blood is very thick. So, it's just like trying to ice a cake. If you try to ice a cake through with one of the squeeze icings and you've had the icing in the refrigerator and it's cold and kind of hard, it's a lot harder to squeeze that out of that the tip of that icing tube than it is if that icing has been in the microwave for 15 seconds. Back pressure also creates a natural resistance, and this is what I was talking about earlier when we were talking about the venous and the arterial systems having pressure within themselves. Of course, like I said, the arterial system is under a lot more pressure than the venous system, but still that pressure is there. And it's going to exert a back pressure onto the solution that you're trying to infuse. Typical arterial pressure is 5 to 80 millimeters of mercury. Pressure within the veins results from the weight of a column of fluid in the catheter tubing. Okay, that's also known as hydrostatic pressure. And gravity is what causes the weight of the fluid to be present. Fluid always flows from an area of higher concentration to an area of lower concentration, which we learned back in our high school days as well. So, if you have a small bag of intravenous fluid and a large body with a lot of fluid circulating through it, natural tendency is going to be to want to put pressure back up into that tubing. So that's why we have to have enough pressure to overcome the pressure from the veins and the arteries. So what does this mean in the long run? Well, if your tubing is narrow or your needle gauge is too small, you're going to have more pressure applied to that IV solution in order to infuse it. Now, used to, we infused a lot of intravenous solutions via gravity, especially just hydration fluids. But because of changes in safety mechanisms and safety of the patients in general, we have now gone that everything is typically infused with a pump. Now, there are a few instances in the home where we use infusion balls or bulbs to infuse that medication. However, those have their own indwelling pressure that is constantly applied to that solution to ensure that fluid is infused. Now, you can really tell a huge difference if you're infusing using one of these balls or bulbs, medication balls or bulbs, and you're trying to infuse through an arrow needle, because it will cause your infusion to go slower because you can't really up the pressure on that ball or that bulb. However, with a pump, you can. So that's one of the things that you need to take into consideration depending on what environment you are in as far as administering the infusion. If the pressure within the vascular system is high, more pressure is required to infuse the IV therapy. As I said previously, you can infuse via gravity. They used gravity infusion a lot. But basically, that just allows pressure on the solution for infusion to come from the external force of gravity on the outside of that infusion, or the outside of the bag of that infusion solution. The effects of gravity on the flow rate can be impacted by clamps. Of course, if you've got your tubing clamped, gravity can't exert enough pressure to overcome the clamp, pressure exerted by the clamp. You can also have rate minders, which allows you to actually set a rate based on a gravity infusion. You can actually set a rate for that. And basically, it just either puts enough pressure on the tubing to let it run faster or slower. Venous spasm or pressure changes can affect the rate of infusion if you're infusing by gravity, movement of the patient, and bent or kinked tubing. So this is one of those instances where I talked about on one of the previous lectures about using the antecubital fossa. That's all fine and good. It's a large vein, but if that patient bends their arm and you're infusing by a pump, you're going to be a whole lot more likely to have enough pressure to continue that infusion as opposed to gravity. If you're infusing via gravity and that patient bends their arms, you might as well just forget it. The infusion's not going to run. However, with a pump, sometimes you can't have enough pressure exerted from the pump to actually infuse, even though the catheter may be kinked or bent just a little bit. So what does this really mean as far as gravity is concerned? Well, the higher the bag, the faster the infusion will run. So if you have a bag of normal saline and you have it laying beside the patient, at the patient's head, it's going to infuse a whole lot slower, if it infuses at all, compared to if you have it hanging on an IV pump. So the higher you have the tubing hanging, the faster it will run. Now, when I worked in home health, this was significant because we did administer medications through gravity oftentimes within the home. And you can have a dial on the tubing that says, okay, we're going to run this IV antibiotic at 100 milliliters per hour. However, if you don't have the IV tubing or the IV bag hanging up, it's not going to run that fast. Now, if you were to have the tubing set at 100 mils per hour and you lower the tubing, it's going to run slower. If you raise it really, really high above the patient's head at 100, it's going to run a little bit faster. So you really need to take that into consideration. Flow is the rate at which the infusion enters the body. Flow rates are determined by body surface, clinical condition and age, patient's level of tolerance, composition of the solution, height of the infusion container, clots in the catheter, change in the position of the catheter, and venous spasm. So what does this mean? Okay, the larger the person, the more fluid and the nutrients are required, and the faster the infusion can be run. If you have a very small boned, very feeble person, you're not going to be able to run an infusion very rapidly because they're not going to tolerate it well. A patient's heart and kidney issues can also impact the rate at which a solution is infused. Patients who have heart disease or kidney disease may not be able to tolerate a fast infusion rate because it stresses the heart and the kidneys, which can send them into fluid overload, congestive heart failure, and cause some pretty serious problems. Now, when I worked in the same day surgery unit at Holston Valley, we actually ended up doing a lot of blood transfusions. So we would always note, whether or not on admission they had any heart or kidney disease. If they did have issues, number one, the rate of infusion for the blood transfusion would be slower. But also, oftentimes they would pre-medicate them with, of course, Benadryl for allergic reaction, but then they would medicate them directly after each unit with Lasix, which would help to pull some of that fluid off, so that it didn't impact their heart or their kidneys quite as negatively. Some patients just don't tolerate a rapid infusion, and that can vary. You can have the healthiest of patients, but maybe they just don't tolerate it. Some medications have to be infused slower than others so that they don't experience adverse reactions or negative effects from those medications, blood being one of them, chemotherapeutic agents being one of them. The higher the container, the faster the rate of infusion. Again, this really impacts the patient who's receiving infusion by gravity. A blood clot in the catheter will slow the rate of infusion. A change in the position of the catheter will result in a change in the infusion rate. One of the biggest issues that I have come across in clinical practice is the needle bevel being up against the side of the catheter bevel being up against the side of the wall of the vein, which will slow the infusion. And then venous spasm can also impact flow rate. If your veins are spasming, that means there's an increased pressure, even more so than what the normal venous system has. So if they're spasming, then that's going to mean you're going to have more pressure to overcome the pressure from within the venous system, which means that your rate may slow down if you're having a venous spasm, because what your pump was set at and the rate of infusion is not able to overcome what the venous spasm pressure is exerting on the venous system itself.